Chest X-ray looks confusing for most MBBS student, but if you follow just 5 simple steps, reading a chest X-ray become very easy. Welcome to Radiology Simplified. Here we explain radiology concept clearly. Okay, for MBBS students and interns. Okay, what we have to do, a step-by-step approach is very important. How we will start, you have to follow a pattern. What is that? Doctors ABCD. What is D? D mean details. First we have to see the details. What is written on the chest X-ray? And R is RIPE. RIPE R mean rotation. How to see the rotation? For rotation we have to see the clavicle, the position of the clavicle from the spinous process, if the both clavicles are equivalent or not. Then I mean inspiration. How to see inspiration? From counting the ribs, anterior and posterior. Either we can count 6 anterior ribs or 8 posterior ribs. So there are many students who are confused between anterior and posterior ribs. So these, what we can see clearly, these are posterior ribs. Okay, and these, what we are curved like this, these are anterior rib. Anterior rib should be 6 and posterior should be 8. Now what is then P? I hope you are understanding it very well. P is projection. How to see projection? Either the view is anterior AP view or a PA view, that is projection. Then again what we have to see is exposure. E is exposure. Exposure, how to see the exposure now? Look at it very carefully. From this cardiac picture, from this heart, if you are able to see this vertebrae, that is a good exposure. So now next, what is next? Next is our ABCDE. A is airway. Just follow the airway. Airway is this. This is trachea. This is trachea. And this is trachea. It will divide into two parts here, where we have to see this is aortic notch. Aortic notch is a landmark where this trachea split into two. You can easily see it very well. This is trachea splitting into two parts. Okay, I hope you can see it very clearly. Then we have to see, this is normal thing. Then breathing. What is breathing? In breathing we have to see vascular this lung field. This lung field we will see in breathing. What we will see here are vascular margins. Either there is any consolidation or any fluid present here. So we have to identify. Always you have to compare both the fields. C is, what is our ABC? C is cardia. Cardia is heart. What we have to see in heart is the size of the heart. If this is cardio and this is thoracic, this is cardio-thoracic ratio. If the cardio-thoracic ratio is more than 50%, we call it cardiomegaly. So everybody, cardiomegaly. And then D is diaphragm. We have to see diaphragm. The right diaphragm will always be higher up than the left diaphragm because of lever. Then E is extras. What is extra? Extras mean if there is any tube present, if there is any pacemaker, anything, that is called extra. So okay, finally examine the bone, ribs, clavicle, spine. Never forget the bone. Fractures are commonly missed in chest X-ray. Common mistakes include jumping directly to diagnosis, ignoring film quality, and not following a fixed sequence. So I suggest everyone to always use the same step-by-step approach. If you are an MBBS student or preparing for NEET PG, subscribe to Radiology Simplified for clear and beginner-friendly radiology video. Thank you so much. Have a nice